We are here at Arctic Diagnostics, where we'll be talking with CEO and President of the company, Greg Hines, and he's going to share more about the next generation and AMD genetic testing. Great to have you with us.
Thank you.
Thank you for letting us have a moment with you. So tell us about the macular risk NXG.
Yeah, macular risk NXG is a prognostic test for macular degeneration. Macular degeneration is essentially an inherited disease. And so what we've developed here in macular risk NXG is a test that's mostly genetic to cover off all of the inherited features that might cause this disease, as well as combining that with an eye examination from your doctor to predict a patient's risk of going blind from this disease in the next 2, 5, or 10 years. It's quite a simple test to do, actually. The doctor can do it in his office from a simple cheek swab. So it's about 90% accurate at predicting which patients are going to go blind from macular degeneration.
So Greg, why should a doctor use AMD testing?
That's the pivotal question. The aspect of this disease that's most important to know is that 10% of Caucasians will go blind from this disease as they live through their 70s. It's unbelievably common. And the issue that a doctor has in diagnosing and managing this disease is he doesn't know who the individual is going to be that's going to lose their sight. And this is a disease that starts when we're in our 50s. We get these little yellow spots on the back of our eye that the doctor can detect on a routine eye examination. And of all of the people that get those spots, only about 20% of them will actually end up going blind. And the doctor can't tell. If he lined 10 people up in his room that all had the little spots on the back of their eye, he doesn't know which 2 are going to go blind. He doesn't know how to manage all of those people. So by simply running the macular risk NXG test on those 10 patients, he can identify the 2 people that are going to go blind, he can give them preventive therapy, he can put them in a disease management program, and he can refer them to a specialist before they go blind. What's happening today is that the primary eye care professional doesn't know who's going to go blind. Those patients don't get any education. They don't know they've got the disease until after they go blind. And that's when they get referred to the specialist and get treated, but by then it's too late. So here's an unbelievable opportunity for the eye care professional, the primary eye care professional, to identify this disease early, to manage it early, to educate the patient early, and to refer them to a specialist before they go blind, instead of what's happening right now, is referring them after they go blind when it's too late.
So you actually do have a test kit in your hand. Can you run through us briefly how the test actually works?
Sure, thank you. These test kits are available to doctors at no charge from the company. So when the doctor sees a patient that has early signs of macular degeneration, they would simply open a test kit, take out a cheek swab. This is a kind of a cheek swab that the FBI might use to do a DNA test. It's a simple cheek swab that the doctor then takes of the patient, puts it back inside the kit, and FedEx comes and picks the kit up, takes it to our laboratory for processing, and 2 weeks later the doctor gets the results, which he can then discuss with the patient, set up a disease management protocol, and maybe prescribe some treatments for the patient.
So can you briefly run through how a doctor would get started using these tests?
Sure. Doctor can get started fairly easily. What he needs first is he needs to have some test kits and a little bit of training. So the doctor can get access to the test kits by registering with our laboratory. He can do that online at www.macularrisk.com. Registration form, registered, and then we send the doctor at no charge a supply of test kits. We also then arrange training for the doctor and for his staff. That training can be done in person. That training can be done over the internet. And we run those trainings over the internet weekly so that our practice, the staff, the doctor, everyone can get online, they can ask questions, and they can understand how to do the test, how to read the patient report and interpret it, and then how to put a treatment plan in place for the patient.
Certainly seems like it would be a very beneficial diagnostic test for optometrists to use.
Absolutely. This is very, very important in today's aging population. The statistics are incredible. There are about 10,000 baby boomers in the United States that turn 65 every day. That's going to continue for the next 20 years. Of those 10,000 people, 500 of them will develop the most advanced and blinding form of the disease every day. There are only 1,800 specialists in the country to manage those patients. So in order to manage and prevent the disease in those 500 patients every day, the impetus and the responsibility lies with the optometrist, the primary eye care provider. It's extremely important that optometrists pick up the baton and manage macular degeneration.
Greg, those are certainly alarming statistics, and we appreciate you sharing that information with us today. Thank you.
Thank you very much for the opportunity. Appreciate it.